Welcome back. The month of November, Lung Cancer Awareness Month, it is dedicated to sharing the importance of getting your lung scanned, not something that we talk about very often. Joining me this morning is Dr. Greg Durham, an oncologist at IU Health, and you're here this morning to tell us all about it. Good to see you.
Great to see you.
Absolutely. Yes. Let's talk about why it's so important to get our lungs scanned. Let's talk about the importance, and then we're going to dive into who should be getting their lungs scanned.
Sure. It's important because mounting evidence suggests that getting a lung screening CT scan helps patients to detect their cancer earlier when it's more treatable and even potentially more curable. And it also has been shown to save lives. So getting those lung scans actually helps people to live longer and to be treated in a better way.
I know a lot of people are afraid to go to doctors. They don't like to be any part of it. But again, I'm assuming that this scan is relatively easy.
It is. It's a chest CT scan. It only takes a few minutes, 15 minutes to get. It's very non-invasive. It's non-painful. And it's not like some people's patients are claustrophobic. It's not like an MRI where it's very close. It's a much more comfortable experience.
Okay, now, who should be getting their lung scanned? I mean, I came over, I said, wait, I'm going to be 53. Do I need to be getting my lung scanned? And you said, probably not. But who should be getting their lung scanned?
Sure, we want to target patients who are at the highest risk of developing lung cancer. So typically we want patients who've smoked for about 20 years or more. And then typically we want to target patients who are between the ages of 50 and 80. So if you fall in that 50 to 80 age range and you've smoked for 20 years or more in your life, then you would qualify for a scan.
Okay, and is that something that you set up through your primary care physician, and they say, hey, this is where you need to go, and this is what you do?
Yeah, I think there are a lot of ways. Actually, primary care is a great way.
Okay.
So talking to your primary care physician, if you have a pulmonologist, for instance, a lung doctor that you see, they can also help set this up. And there's also self-referral programs to many of the organizations in town.
Oh, good. Okay, so now signs and symptoms. If we're kind of beyond getting that scan, maybe and we haven't done it, and we're thinking that maybe we have something going on and we're concerned about it. What are some of the signs and symptoms that we need to be aware of?
Sure. So cough, worsening cough, particularly cough that is productive of blood or reddish tinged sputum. If you're having worsening shortness of breath that's not improving, if you're losing weight unintentionally, unexpectedly, or if you're just having chest pain or other symptoms that are not getting better, those can be signs that you really need to go and see your doctor to get an evaluation.
And we talked about this too. There's a lot of stigma around it. And I'd like for you to dig in a little bit on that, because anywhere that there's a stigma around, we're creating issues for people not getting help.
Yeah, absolutely. Stigma is a real challenge with lung cancer, right? A lot of studies have shown that there's a lot of self-stigma that goes along with this. People think, well, I smoked, so in some ways maybe I brought some of this on myself, and we don't want people to think that way, right? Nobody deserves to get lung cancer. No one deserves to get any type of cancer, and these stigmas just get in the way of people getting the right care and getting these screening CTs and getting the support that they need. So we really want to really tell patients that there are lots of reasons for lung cancer: environmental reasons, asbestos, air pollution, secondhand smoke, even genetic. So smoking isn't the only cause, and they should never feel that they brought this on themselves or that they were deserving of it, because we really don't want them to feel that way, because it just gets in the way of that treatment.
Well, I want you to be my doctor. If I ever need to see somebody, I'm going to come see you. Like that. So if you have more questions, we have information, more linked to our website as well, fox59.com/links. Dr. Durham, thank you
Yeah,
so much.
so much.
Good to see you. Absolutely.